Hello, I'm Dr. Steven Michael OBE. Who am I? A long-serving health leader, having worked in the NHS and associated fields for the last 36 years. For 10 years of that, I was chief executive of a local NHS Foundation Trust. My work now revolves mainly around chairing local charities, well, one local charity, one national charity, and as well as providing non-executive support to integrated place-based developments in health and social care within Cheshire. I was basically looking at asset-based development, which is community assets, and how they can provide support to mainstream healthcare. And in particular, what I was looking at is, can you sustain that type of innovation? And in doing so, what is the kind of strategy that needs to be employed, and what type of business model design also needs to be employed as part of that work? So that was really the basis of my research. My original organisation, of which I was the chief executive, I think it's added and provided more clarity in terms of the strategy they've adopted to date and the business model that they need to adopt to move forward in a more sustainable way. So I think the research was well received. The first 2 to 3 years of it I did while I was CEO, but thereafter I did it in an independent capacity. But the reports are it has been useful. They say you can't teach an old dog new tricks, but you can. I've learned an awful lot about myself in terms of reflexive practice. So what I've learned is the ability to test out my taken for granted assumptions at all points within the system, and also help others to test their own taken for granted assumptions about why are they here, why does the management entity exist, what its purpose is and what it's trying to do. So I certainly took that away. And I've been able to apply that in a range of different contexts. So for example, the work I've done on the place-based developments, particularly the place-based developments, how they are influenced by different worldviews and different approaches that people bring. As I said before, they're taken for granted assumptions. The other areas that I would say I've been able to work in is in linking to the university. One of the charities that I chair, we began by providing placements to some of the students involved in the consultancy projects, but that has extended further. And we're now working on quite an extensive project around UK community renewal. What I took from that was the impact side and the ability to marry up research-based practice with management practice itself. So in a way, I think the course taught me how to be a pracademic, if you want to describe it as that. I think that if you're going to benefit from the DBA, you have to be a senior manager. I think that other programs, and I benefited myself earlier in my career from an MBA program, but I think they are more suited to senior managers who are more self-directed in their study, but work out how they can learn in an academic environment and apply that carefully and sensibly in management practice. So yes, I would do that. The first thing for me is it is no easy journey. And if you're going to enter on this, it is not an easy journey. There are no shortcuts, particularly in terms of the research. You have to be particularly rigorous, and you have to learn a new set of academic skills. And I would say that giving advice to anybody coming on the programme is, if you're going into that, be prepared for hard work, but it is rewarding at the end.